What is migraine? Migraine is a chronic disease characterized by recurrent headaches. Migraine attacks can last for hours or even days and can significantly limit a person's daily activities. They are usually characterized by severe pain on one side of the head, nausea, vomiting, and sensitivity to light or sound. Migraine is a multifaceted problem that is not only limited to headaches, but also reduces the quality of life of the person. In this video, we will examine in detail what migraine is, its causes, symptoms, and coping methods. What are the causes of migraine? While the exact cause of migraine is not known, it is thought that a number of triggering factors can lead to migraine attacks. Here are the possible causes and triggers of migraine. Genetic predisposition. People with a family history of migraine are more likely to have migraine. Genetic factors can play an important role in the occurrence of migraine. Hormonal changes. Especially in women, hormonal changes can trigger migraine attacks. Hormonal fluctuations such as the menstrual cycle, pregnancy, and menopause can increase the risk of migraine. Environmental factors. Environmental factors such as weather changes, bright lights, loud noises, and strong odors can trigger migraines. Diet and nutrition. Some foods and drinks can trigger migraines. In particular, foods such as alcohol, especially wine, caffeine, chocolate, processed foods, and cheese can trigger migraine attacks. Stress and anxiety. High levels of stress and anxiety can trigger migraines. Intense work tempo, emotional distress, and psychological stress factors can increase the risk of migraine. Sleep pattern. Sleep irregularities, insufficient sleep, or excessive sleep can trigger migraine attacks. Regular and quality sleep plays an important role in reducing the risk of migraine. What are the symptoms of migraine? Migraine symptoms may vary from person to person, but common symptoms are as follows. Headache. The most prominent symptom of migraine is a severe and throbbing headache. This pain is usually felt on one side of the head, but can sometimes affect both sides. Aura. Some people may experience visual disturbances, flashes of light, blind spots, or other sensory changes, aura, before or during migraine attacks. Nausea and vomiting. Nausea and vomiting are common during migraine attacks. These symptoms can increase the severity of the pain and worsen a person's general condition. Sensitivity to light and sound. Hypersensitivity to light and sound, photophobia and phonophobia, can occur during migraine attacks. For this reason, migraine sufferers often want to rest in a dark and quiet environment. Fatigue and weakness. After a migraine attack, a person may feel extremely tired and weak. This may last for a few days in the post-migraine period. Methods of coping with migraine. Migraine attacks can negatively affect quality of life, but their frequency and severity can be reduced with various methods. Here are methods to cope with migraine. Medication. There are various medications used in migraine treatment. These medications can be effective in reducing the frequency and severity of migraine attacks. Your doctor will determine the most appropriate treatment plan according to your migraine type and symptoms. Lifestyle changes. Adopting a healthy lifestyle plays an important role in reducing migraine attacks. Exercising regularly, eating a balanced diet, getting enough sleep, and managing stress can reduce the risk of migraine. Stress management. Various techniques can be used to reduce stress. Meditation, yoga, deep breathing exercises, and regular physical activity are effective methods to reduce stress. In addition, taking up hobbies and engaging in relaxing activities can also help manage stress. Nutrition and diet. It is important to avoid foods and drinks that can trigger migraines. Avoiding triggers such as alcohol, caffeine, chocolate, processed foods, and cheese can reduce migraine attacks. Eating regular meals and drinking enough water can also reduce the risk of migraines. Regular sleep. Getting regular and adequate sleep is an important factor in reducing the risk of migraine. Going to sleep and waking up at the same time every day can help you maintain your sleep pattern. Also, creating a relaxing routine before going to bed can improve your sleep quality. Alternative treatments. Some people may benefit from alternative methods of migraine treatment. Acupuncture, biofeedback, massage therapy, and herbal supplements can be effective in relieving migraine symptoms. However, the effectiveness of these treatments may vary from person to person, and it is important not to use these methods without talking to your doctor. Keeping a migraine diary. Keeping a migraine diary can be useful to keep track of migraine attacks and triggers. In this diary, you can note the frequency, duration, symptoms, and possible triggers of migraine attacks. This information can help your doctor personalize the treatment plan. In conclusion, Migraine is a chronic disease that significantly affects quality of life. However, with appropriate treatment and coping methods, the frequency and severity of migraine attacks can be reduced. Understanding the causes and symptoms of migraine is an important step in coping with this condition. You can cope with migraine more easily with healthy lifestyle changes, stress management, and treatment methods recommended by your doctor. Remember that individual differences are important in migraine treatment, and each individual's treatment plan should be personalized.